While examining the liver, the cranial stomach is also on the ultrasound screen. Any lesions of the cranial stomach are usually noted while examining the liver. We need to develop some habits for the exam. Remember to keep the area of interest centered on the ultrasound screen to reduce artifact. This is best accomplished by holding the transducer perpendicular to the patient's body and the organ of interest. Adjust depth to fill the ultrasound screen with the organ of interest. If needed, adjust transducer frequency for the current depth. Adjust gain for the best image. And adjust focal points to the bottom of the organ of interest. Remember to keep one finger of the keyboard hand on the freeze button, ready to capture the best image. When you press the freeze button, practice leaving your transducer hand relaxed and in position so that when you unfreeze, you will still have the same image. This will save you time and effort. We will continue with the 12-pound Yorkie. When finished examining the liver, angle the transducer caudally till it is perpendicular to the stomach and the patient's body. Center the stomach on the ultrasound screen. We need a standard measurement of the stomach wall with every patient, so decrease depth as much as possible to magnify the stomach wall. Search for a place where the 4 layers of the stomach wall can be seen. When you have a good image, press the freeze button and use Cinematic Loop to select the best image. Press Caliper or Measure and place one caliper at the interface between the hyperechoic lumen of the stomach and the hypoechoic mucous membrane layer. Place the other caliper on the outside of the hyperechoic serosal layer of the stomach. Label the image stomach and save the image to the patient record or archive. Unfreeze and increase depth to fill the ultrasound screen with stomach. Slide the transducer caudally to center the caudal wall of the stomach on the ultrasound screen. While examining the liver, we saw the cranial wall of the stomach. Now we want to concentrate on the caudal wall of the stomach and the left limb of the pancreas. The left limb of the pancreas is located between the landmarks of the caudal stomach wall and the transverse colon. Normal pancreas looks like fat, omentum, or mesentery, and usually is not recognized. Slide the transducer to the patient's right side till the stomach disappears. Adjust depth if needed. Then reverse directions and slide to the patient's left side till the stomach disappears. Try to keep the caudal wall of the stomach centered on the ultrasound screen. The stomach wall is usually evenly thickened between rugal folds. In live two-dimensional ultrasound, the stomach contracts about 5 times a minute or once every 12 seconds. If the patient has not been fed in 12 hours, the stomach is expected to be empty. Dogs often swallow air, and even an empty stomach may have a lot of gas artifact. Look for lesions of a thickened stomach wall, loss of wall layers, excessive contractions, lack of contractions, masses with acoustic shadows, and ulcers. Examples of these lesions are shown in the Stomach and Pancreas DVD. Landmarks are important to help you find organs, especially if you do not recognize an organ because it does not look normal. The liver is cranial to the stomach. The transverse colon is caudal to the stomach. The transverse colon usually has a large acoustic shadow. The left limb of the pancreas is also caudal to the stomach, but usually looks like fat. Edge shadowing is described in the Tips and Techniques DVD. Any organ with curved edges can have edge shadowing. Part of the ultrasound beam at the curved edge is refracted, resulting in a lack of reflected return from that area. The ultrasound machine places a shadow in the area where there is no return. To reduce the cranial edge shadow, slide cranially and angle caudally. To see more of the caudal stomach wall, slide caudally and angle cranially. Gas artifact is described in the Tips and Techniques DVD. Gas completely reflects the ultrasound beam, and the beam bounces back and forth between the transducer and the gas, causing a hyperechoic reverberation. This artifact may be called a comet tail. The artifact shows the presence of gas in an organ. Gas is often seen in the gastrointestinal system. This artifact blocks your view of deeper structures. Once the abdominal exam moves to the stomach, the first thing to do is decrease depth to magnify the stomach wall and measure it. This gives your eye something to compare other parts of the stomach wall to. Find a place between rugal folds and press the freeze button. Use Cinematic Loop to select the best image. The normal stomach wall has 4 layers: an inner hypoechoic mucous membrane layer, a hyperechoic submucosa, a hypoechoic muscularis layer, and an outer hyperechoic serosal layer. Press caliper or measure and place one caliper at the inner face between the hyperechoic lumen of the stomach and the hypoechoic mucous membrane layer of the stomach wall. The other caliper is placed on the hyperechoic serosal layer of the stomach wall. The calipers should be perpendicular to the stomach wall. If the calipers are at a diagonal, the measurement is falsely increased.